Today, Pfizer announced its coronavirus vaccine has proven to be 100% effective in preventing illness in children ages 12 to 15 during clinical trials. KXAN's Jacqulyn Powell looks at how soon children could begin to receive the vaccine here.
A good number of the kids ages 12 to 15 participating in Pfizer's COVID-19 vaccine trial are here in Austin.
Judging from the response of, parents bringing their children in for these COVID vaccine trials, there's a lot of excitement.
Dr. Manish Naik is with Austin Regional Clinic, one of the places participating in the study. He says more families signed up their children than ARC could even enroll. But for those parents who may still be skeptical, he says the data looks promising that the Pfizer vaccine is proving safe for kids.
There's not anything about the mechanism of how these vaccines work that should raise a bigger concern in children than they do in adults.
Naik says the FDA will still have to study those findings, but he expects that at least older children could be offered a vaccine in time for the new school year. And those are the kids local health leaders say need it the most. Austin Public Health data shows last week positivity rates among our middle and high school students were much higher than the area's overall positivity rate of 4.3%. So with the expectation that a vaccine for kids 12 and older could likely be available by this summer,
it gives us enough time to ramp up vaccination, to reach those groups, to make it much safer in the fall for the return to more regular in-person education.
Jacqulyn Powell, KXAN News.
Dr. Naik tells us trials for children younger than 12 are not as far along yet. APH says researchers still need to figure out the exact dosage needed for smaller children. Pfizer plans to go ahead and request emergency use authorization for the vaccine in kids ages 12 to 15 in the coming weeks.